Good afternoon from UNICEF in Acenti, the Global Office of Research and Foresight in Florence, Italy. Thank you for joining us for this penultimate session in our webinar series, Beyond Barriers, where we're looking at the opportunities in conducting disability inclusion research. My name is Gavin Wood. I'm the Global Research Manager for Inclusion and Disability in Acenti, and I will be your moderator today. A big thank you to all of you who joined us in our previous webinars, looking at including last Wednesday's session on assistive technologies. First, I just want to say why we're here. Children with disabilities, that's 240 million worldwide, remain amongst the most under-researched and underserved populations globally, particularly in low and middle-income countries and in humanitarian settings, the topic of today's discussion. Despite growing commitments to removing the barriers to inclusion, critical evidence gaps persist, leaving policymakers, donors, and practitioners without the knowledge needed to design inclusive interventions. And through this series, we have been bringing together experts and panelists and advocates to explore both the challenges, but focusing on the opportunities to conducting research with and for children with disabilities. Today, we'll be exploring the topic of research for children with disabilities in emergencies, so in humanitarian settings. If you haven't already, you can register for our final webinar using the link, which should be appearing now in the Q&A box. Sorry, in the Q&A box, excuse me. But before we begin, just a few housekeeping notes. Closed captioning is available, and if it's not switched on, you can enable it via the Zoom settings in the menu below, clicking on the CC button. International sign interpretation is also provided, thanks to our colleagues at Overseas Interpreting, who are supporting us throughout this series. Our thanks also go to Altamont Group, who are leading the curation and facilitation of this webinar series. They will be supporting the smooth running of this session and also helping to review the questions during the Q&A. Before we start, we would like to begin with a poll, which will be popping up on your screen any moment now. So this is your opportunity to interact. So here it is, it's on the screen now. The first question is, what do you see as the biggest barrier to disability inclusive humanitarian research? You have to pick one choice, and there are 5. The first is lack of data collection methods suitable for crisis settings. The second, ethical challenges of conducting research in emergencies. The third is limited funding. 4, the short-term research priorities. And 5, weak integration of disability inclusion in humanitarian response. So I'll just give you a few moments for you to contemplate and then provide your answers. Thank you. So make your selection, it'll be closing, and we should see shortly the results on the screen, which I will read to you. Okay, so by far the biggest, so nearly 60% of you are saying that it's the weak integration of disability inclusion in humanitarian response. And so the absence of this is something, so how can you research something if it's not there, I guess, is what's coming through here. Limited funding, of course, has come up. 14% of you have said that. And then short-term research priorities, 29% of you have mentioned that. And we'll be discussing some of these themes as we go through. So nobody said lack of data collection methods or any ethical challenges of conducting research in emergencies. That's very interesting. And we'll be touching on these topics as we go through. So thank you so much for that, for getting us going. I want to share with you first the agenda. So we'll start with 3 presentations from our speakers, each focusing on a specific dimension of today's topic. This will be followed by a moderated panel discussion where we will explore some of the key challenges and barriers to conducting research in this area. And after that, we will open the floor to you for an interactive Q&A session, giving you an opportunity to engage directly with our speakers. So throughout this series, we are making a very deliberate effort to ensure a guaranteed space for you for 30 minutes for you, the audience, to submit your questions. So please feel free to submit them at any time using the Q&A box, which you should see at the bottom of the screen. And then we will address those during session 3. We will, of course, remind you just before that session for more questions. So if you haven't submitted a question by then, you'll still have the opportunity to do so. Throughout the session, you'll be invited to take more polls to share your perspective and then conclude with a wrap-up and some concluding remarks. So let's get into it. I'm delighted to be introducing today's speakers, who will be giving a short presentation, each offering insights into specific aspects of children with disabilities and emergencies, whilst also acknowledging, of course, that there is a lack of research in this space. So we're really looking forward to a discussion which builds upon the challenges and opportunities for increasing what is a very sparse area and focus of research. Each will have approximately 10 minutes to speak, and I would now like to introduce. So first we have Birgit Roverde, is a researcher in Participation, Inclusion and Social Change Research Cluster at the Institute of Development Studies. Her current work mainly focuses on themes of social justice and inclusion, particularly disability inclusion in low income and crisis context, using participatory methods. Her research interests include disability stigma, forced displacement, and marginalized groups' experiences of conflict, crises, and humanitarian response. We're welcoming back our friend Israel Balogan. He describes himself as a Nigerian medical practitioner with a disability and has achieved the distinction of being the recipient of the Global Study in the UK Award 2022, organised by the British Council. This recognition stems from his outstanding efforts in championing and fostering dialogue on disability and gender inclusivity in the public sphere. He has 2 master's degrees, public health from the London School of Hygiene and Tropical Medicine, another in international comparative disability law and policy from the University of Galway, Ireland, which was obtained via the Irish Roger Casement Fellowship, and currently a Commonwealth PhD student at the University College London. And then Maria Kett is Professor in Humanitarian and Social Inclusion and Director of the Centre for Humanitarianism and Social Inclusion at the University College London, UCL, in the Institute of Epidemiology and Healthcare. She is also the Programme Director for the UCL MSc Humanitarian Policy and Practice. She is a social anthropologist by training and has worked in over a dozen countries in Africa and Asia, leading a number of research programmes in the field of disability and international development. Her work has been at the forefront of the disability and international development sector, working at the intersection of research, education, policy, and practice in the global humanitarian field. She is also co-founder of the Global Disability Innovation Hub, leading on their humanitarian-focused work. Maria also happens to be our first speaker, so I've got this great pleasure in inviting Maria to open with an overview of key definitions and concepts related to disability inclusive humanitarian action and setting the stage for today's discussion. Thank you so much, Maria, and over to you.
Thanks, Gavin, and really nice to be here, and so pleased to see many of you here joining us. I've got the rather odorous task of trying to sort of define what we mean by some of these concepts we're talking about: disability inclusive humanitarian action, research, and some of the approaches. So perhaps I'll start by thinking about what we mean by disability inclusive action in research. I'll talk in the next slide a little bit more about what we mean in general by disability inclusive humanitarian action, but I wanted to talk a little bit about research, because I think while we know, or at least we think we do, what we mean by disability inclusive humanitarian action, perhaps in research context, it's less agreed. There's less discussion and agreement about it. There are various different approaches, of course, and I'll talk about some of those. We also know that despite several decades now of law, policy and guidance to support the inclusion of persons with disabilities, that's not always the case in humanitarian action, and even less likely to be the case in research. We know there's a lack of research in humanitarian contexts in general for reasons of securities, priority, and some of the other reasons that I think we'll touch on over the course of this seminar, but there can be an even bigger challenge around research on children with disabilities, and again, ethics and other challenges that I think we'll pick up on in this seminar. Of course, and this is really important to say from the outset, doing research in humanitarian context is of course challenging and very often has to pivot. And I think that sort of need to be flexible and how we pivot that research is something that we need to keep in mind, and I will come back to. There isn't one definition really about what we mean by disability inclusive action. But what I do know is that there has been a tendency for that research to have rather focused on the technical aspects of inclusion. And what do I mean by that? So rather than look at the political underpinnings or the causes of conflicts, or perhaps more critical discussions around disability theory, we've tended to focus on how do we do disability inclusion. And that's been perhaps at the expense of understanding the political drivers of exclusion in humanitarian contexts. And I think that's a really important point to bear in mind. It's something, again, that I think we can pick up on the course of our discussions. To really underscore that, a colleague who works in the field of disability inclusive disaster risk reduction, Sean Grech, recently observed that one of the challenges is this focus. We've focused a lot on policies, and that's really important, but it has meant there's been much less focus on the underlying assumptions of why children with disabilities are left out. What are the impacts of these state actions on children with disabilities, and and also what are those mechanisms of those exclusions? And I think that's a really, key point to think about, because what it means is that whilst there's been progress, it perhaps hasn't led to the transformational change we might have liked to have seen across the sector, and was certainly what we were hoping for from the UN Convention. And I guess it also brings us to what we mean by research. And there are many different types of research. There's, of course, qualitative, quantitative research, but in academic research, we also think about types of research, peer-reviewed, grey literature, how we sort of sometimes put those into a hierarchy of quality of research. But I think it also raises questions. Why are we commissioning this research? What are we trying to do with the research? How do people access that research? How are they accessing the grants and fundings that often underpin that research? But also around the language we use, the leadership and the collaboration and co-production opportunities around that. And I think I want to come back into really highlighting that there's a real need to bring in this variety of perspectives, disciplines and voices to enhance research. And I hope and think that can lead to a paradigm shift. Next slide, please. You probably don't need me to explain to you how disability inclusion has been defined within humanitarian emergency and fragile contexts. Article 11 talks, of course, about the rights of persons with disabilities and the obligations of states to protect and the safety of persons with disabilities in situations of risk, armed conflict, humanitarian emergencies and disasters. Again, a broad spectrum doesn't specifically talk about children with disabilities, but we know, of course, there's a convention on the rights of children with disabilities, and articles in the convention's CRPD talk about children with disabilities. So this is the conundrum. Should we just have a broad scope, or should we have a more specific focus? In 2017, UNICEF produced 6 lovely booklets, which were really in collaboration with Handicap International, that were really looking at what the purpose of including children with disabilities is. And it talks about their understanding the need to provide insight into the situation, highlight the ways in which children are excluded, and offer practical actions and tips to better include children with disabilities. I guess that led then in 2019, many of you will be aware of the Interagency Standing Committee Guidelines on Disability Inclusion in Humanitarian Emergencies. Again, this talks about disability inclusion and about meaningful participation, promotion of rights, compliance with the CRPD, the concept of social inclusion. Bridget mentioned this in her, it will mention this as well in her work, but I think what we're talking about here is social justice. And that's, I think, something we need to think about why we're doing research and what we're doing the research for, is to really think about this idea of social justice. Unfortunately, a lot of what the literature and the research around children with disabilities in humanitarian contexts has tended to focus on vulnerabilities. And that's obviously not wrong. Children can be particularly vulnerable in these contexts, particularly children with disabilities. But it does deny children agency, autonomy, and particularly, for example, children with adolescence. And it does tend to focus on a rather less positive story about children with disabilities. Conversely, a lot of talk about resilience often is used without understanding the underpinnings of the mechanisms that foster resilience, including community resilience, or the specific resilience that children with disabilities might have. So I think whilst we again, it's coming back to needing to shift that paradigm. Next slide, please.
Maria, sorry to interrupt you, but getting a request from the interpreters, if you could just slow down a little bit.
Slow down.
Thank you so
Okay.
much.
I will. Next slide, please. So already we know that, as I said, we've been doing this for quite some time now. There's been a lot of work done, some of which I've done, to really understand the kind of guidance around disability inclusion in these contexts, and particularly in a number of specific fields, often in health, social protection, child protection. I think what most of them do, I'll come back to that, what I think most of them do, but they tend to talk about models of disability. But I guess one of the, for example, a medical model of disability, a social model of disability, a rights-based model. And we know this is commonly used, increasingly commonly used in disability-specific research. However, the opposite isn't always the case, that we don't always see that kind of discussion and unpacking in more general research, even when disability is included. There's an uncritical acceptance of, when they talk about disability, what model they're using or how they're thinking or conceptualizing disability. Of course, models of disability themselves are not without criticism, and they can often, quite unintentionally, underpin existing mechanisms of exclusion, becoming normative rather than perhaps critical or challenging. We know a common method that we have used in disability inclusion in both the development and humanitarian context is the twin track approach, where we both mainstream disability and have a specific targeted focus on disability. I think that's perhaps in programmatic work, that's fairly well established, and certainly in disability programs. I think it's less well established in research and much less well established in more general non-disability specific research, more mainstream academic research, for example, on nutrition programs. I think there's often this idea that it's difficult to include children with disabilities. And so they either get lost within the mainstream, or there's a specific only disability focus on those children. So I think thinking about how we mainstream disability across research in general is probably much needed. There are a number of other frameworks that address disability-specific issues, including the WHO Health Equity for Persons with Disabilities, and various other guidelines that we know are available, including other tools for exclusion, the Washington Group short set questions. It wouldn't be a session on disability without talking about the Washington Group. However, I think while we've got very good at measuring disability through the Washington Group questions, which look at a range of difficulties across 4 domains or 7 domains for the children, often that becomes a proxy for disability inclusion. And I think we need to really challenge that merely doing the Washington Group questions in your programme or in your research isn't doing disability inclusion. Next slide, please. I think there have been some really interesting child-led approaches, and I know Brigitte is going to talk about some of those, but I think we still need to think more strongly about how children are really leading that research agenda. There's also been some really interesting methodologies and new methods using, for example, synthetic data, which helps us with the perennial problem where we have gaps in data, for example, around access or need. I have done some work on artificial intelligence. I'm happy to talk about that after. There's a whole raft of challenges around ethics and exclusion. Certainly, most AI algorithms are built on existing data sets, and if children with disabilities aren't there in the first place, then they're not going to be in those. Partnerships, again, this is something we can come back to, but I think we talk a lot about the private sector.
1
but I
minute
think we need to
remaining,
be
Maria.
more innovative in our approaches to partnerships. And I think better in what we're thinking about how good the existing tools are doing. And I think I really want to underscore that we're still tending to silo a lot of work around disability. And I think we need to think much more how we come back to that horrible phrase, intersectionality. It's often used, but do we really understand what it means? But looking across the life course, for example, might provide more insights into how issues change over time for children with disabilities. And my final slide, please. What does this mean in terms of shifting the power? I think we really need to frame our research with a social justice lens. It really genuinely has to be co-produced, not just with the children, but with their caregivers, their families and their communities, and really understand how that research agenda is translated into action. There are moves within academia, and have been for a while now, to see non-traditional, quote unquote, ways of disseminating research, exhibitions, storytelling, films, videos. These are now increasingly mainstream in research, and I think we need to be getting better at engaging with those other opportunities for dissemination. And I think we really need to be better at really engaging with people with disabilities themselves as researchers in that. And finally, I think it should be both emancipatory for children, but really importantly, our research really needs to transform the lives of children with disabilities in humanitarian contexts. And I will end there.
Thank you so much, Maria, for setting the scene so clearly and for unpacking many of these concepts and frameworks in such a short space of time, and also touching here on the possibilities for transformative participatory research in this space. So now I invite Israel to discuss how research is being implemented in humanitarian settings, including the practical challenges, some of the innovations, and lessons from the field. So over to you, Israel. Thank you.
Thank you so much, Gavin, and I'm really grateful for Professor Maria setting the stage. Just to say this, I'm a person with disability myself, and I've been internally displaced, so I understand some of the challenges that could occur for children with disabilities in this regard. So just to say this, following up on what Maria said, the situation is this: the unpredictable and unstable nature of humanitarian setting, depending on the context. Be it natural disaster or conflict, we know that we can't really predict. So that alone is a major challenge for researchers to be able to plan and adapt their research focus, especially when it comes to children with disabilities in emergencies. Another issue which tends to occur is the fact that oftentimes we have limited access to the affected population. Recently, in works done in Iraq, in Somalia, you realize that because of the fluid nature of the setting itself, people are displaced, both as refugee and internally displaced persons. So targeting them, looking out for them might be a major challenge. And just to also say this, in humanitarian setting and emergencies generally, ethical constraint and clearance for the research process remains a major challenge, both from the universities, the government of the host country, and also from people in the field and local actors. You know, there are oftentimes you have to see secure clearance, ethical clearances from the military or security people involved before we now talk about ethics. So this is a major issue. And oftentimes when you are carrying out research in emergency, the need for you to be dynamic, the urgency in decision-making processes. We're going to be discussing that in subsequent questions and answers session later today. You realize that the situation might just change all of a sudden. And for you as a researcher, you need to be innovative. You need to think quick. You need to preempt some of these potential challenges so that when you set the ball rolling, you won't have challenges. And just to say this, of course, data is a major challenge. It's either you have lack of data in some cases, or some instances you have limited data. And the other challenge is that currently usually occur is the funding gaps. People are more interested in prioritizing saving lives than funding research. First, they'll say, look, which one should we prioritize? Let's save lives before you think about research. And even in some of this research, you have the challenges of implementation gap, which could be multifactorial. Next slide, please. So here are some of the innovative approaches that have been used. These are just examples. I believe Rigetti will be talking more extensively on this. We have had issue of using what we call participatory action research, which involves us engaging organization of persons with disability and local communities in designing co-studies. And this has, it has really helped significantly, especially in the humanitarian setting where you have limited access. When you work together with the community, they own it, they believe that, look, you are involving them in decision-making processes. And the other innovative approach that have been used is the use of mobile data collection tools. I remember while working in CBM in Nigeria, my colleagues went to the field and were able to use Kobo Collect to collect our data very rapidly, and oftentimes it limited issues of error, and we're able to also distribute some of the tools to local actors, and they were able to use it. And these are some of the innovation that is coming up. And I'm also aware that you can also use satellite imagery to capture hard to reach area from space. These are some of the things we could be thinking about in recent time. And we also have the issue of using rapid assessment tools like quick surveys, remote interview, online and focus group discussion, which we'll talk more extensively later on today. And I've mentioned it also, the use of remote sensing, satellite imagery for displacement tracking. I think I've seen it being used in Iraq and also in Niger. So these are some of the innovation that is coming up. Next slide, please. So briefly, I'll just mention example of case studies where we have successful integration. One was on inclusive humanitarian action in Syrian refugee camps, which was funded by UNICEF and HI. I mean, HI implemented it in refugee camp in Jordan, and it was really a success. Colleagues, it was a mixed method that involved quantitative surveys and caregiver narratives. You know, it's also very important that you hear the perspective of caregivers or children with disability, or the voices of those who are impacted. And another research that was done recently was the one that was done by CBM, HI, in phase 2 of Leaving No One Behind in the Rohingya crisis on how to mainstream disability in humanitarian actions. And this was really novel because it involves academia, it involves NGOs, both local and foreign NGOs that were involved within the Rohingya crisis. Of course, it happened in Cox's Bazar in Bangladesh. However, some of the difficulty that were encountered stemmed from difficult environment, trust issues, and ethics. I'll be talking about in the next slide, I'll be sharing a personal experience that I had in conducting research in Nigeria, in Maiduguri. Next slide, please. So this research was done in Borno State. If you look at the arrow, the center arrow on the map, where you have the dot where they are insisting, they are pointing arrows on now presently, is where I was stationed. I had wanted to go to this particular environment because this is where I live. I live in the northeast region, in the yellow area, yellow part of the map there. That's where I live. It's my area. But because of ethical issues from my school, I couldn't get access to it. So ethics has been a major challenge. Initially, we tried to co-design this research in close collaboration with persons with disability, because like I said earlier, I'm a person with disability. We've mapped out strategies, how I'm going to come, we'll do it together. But because of ethics issues, security issues, I couldn't go in. So I had to navigate the challenges of ethics from the state government and the inaccessible zone. From Abuja to Maiduguri is about 841 kilometers by road and just an hour by flight. But however, I mean, the ethic, I mean, I couldn't get clearance from my ethics committee, despite the fact that the government were willing to support me, and they were even asking me to come because I've worked there previously. The other issues that may arise, that arose for me rather, is the fact that language barriers. Of course, fortunately, I happen to be speaking Hausa, and despite the fact that majority of the population there were Kanuris. Kanuri is another tribe, a major tribe in northeastern part of Nigeria. Other challenges that I encountered was the fact that how do I identify participants? I'm going to share how I was able to overcome some of these things, and also how I was able to build trust. So just to say this, in the process of doing this research and conducting this research in August last year, there was a flooding that happened in Maiduguri, and that killed even some of my potential participants. It was bad. I mean, for me as a researcher, I felt bad because some of them died in the course of the flooding, and they were persons with disability. The flooding occurred in the middle of the night in September. I had to pause and reflect and waited for another 1 month just to tell you the fact that you can't predict anything within the humanitarian space, be it conflict, be it flooding, be it earthquake, you can't really predict. So, however, subsequently, I was able to overcome this. And one of the issues that I did was, after securing ethics from the school and the state, I had to conduct these interviews via Teams, one in Nigeria and one here. It was a major challenge. And I must confess that I received tremendous support, psychosocial support, even for myself, because I was depressed. in the course of conducting this research. And that thing that was able to like help me, I have a good understanding of the language. I speak Hausa very well, and I also understand the culture. These are some of the challenges and some solutions that I use in being able to carry out this research. I'm still working on it. And thank you so much. For me to share to everyone who has made it possible for me to share this story. I look forward as we engage in the question and answer session. Thank you.
Thank you so much, Israel, for sharing some of those insights, bringing us just into the challenges, but also some of the very difficult situations. And thank you for sharing that difficult moment with us. What you've done really has grounded the insights into the realities of conducting research in the emergency context and sharing some examples of how barriers can be overcome through local engagement and adaptive methods. I'm sure our participants may have also some examples, and so very keen to hear from participants. Type in the Q&A any questions around this for later or any insights that you might have. I now invite Brigitte to take us into the current evidence base, looking at what we know and what we don't know, and how inclusive approaches can help us understand impact more clearly. Now, just as a reminder, if you haven't done so, any questions you want to start putting in, please do so. And just a gentle reminder to speak at a good pace so that the interpreters can sign. So with that, thank you so much, Brigitte. Over to you.
Thank you very much. I'll be building on the issues raised in the previous presentations. So looking at the current state of the evidence, a recent review that I conducted together with Maria for a background paper on disability inclusion and crises, including conflict, natural hazard-related disasters, and health emergencies, showed that there's an increasing amount of evidence which explores the impacts of emergencies on people with disabilities. However, within this, there's very little research which focuses specifically on the impacts of emergencies on children with disabilities. Two scoping reviews on available evidence about children with disabilities and adolescents with disabilities and emergencies, including the recent COVID-19 pandemic, also found that there were very few studies which specifically examined the effects of emergencies on them. The scoping review of adolescents with disabilities found that existing studies often conflate the data of disabled and non-disabled adolescents, disabled adults and adolescents with disabilities, or adolescents with disabilities and their caregivers. So it was much harder to understand their specific experiences. Studies of children with disabilities often focus on their caregivers and don't engage with the children themselves. While caregivers have valuable insights into the lives of children with disabilities, they are not children with disabilities themselves, so may miss important information. What we do know about the experiences of children with disabilities is that they are disproportionately at risk of and affected by emergencies compared to children without disabilities. They've been found to face barriers to accessing key services such as health and education. They experience family poverty and increased social isolation. And there is a lack of consideration of their needs in emergency responses. The focus of existing studies is often on children and adolescents with disabilities' vulnerabilities, the health impacts, including looking at mental health and their experience of violence, and their experience of education emergencies, rather than on the full spectrum of children with disabilities' lives in emergency contexts. Next slide, please. The review of disability and crises also showed that there's less research which looks at disability-inclusive interventions in humanitarian contexts than at the impacts of emergencies. However, there is research which looks at the barriers people with disabilities face in relation to mainstream humanitarian interventions. While progress is being made in relation to disability-inclusive policies, standards, guidelines, and tools in humanitarian action, there are gaps in evidence in relation to research into the impacts of these inclusive tools and policies. One area of increasing research is into the role of organizations of persons with disabilities in humanitarian response. However, again, there is very little research that focuses on children with disabilities inclusion in humanitarian programming, making it harder to understand the specific barriers and ways to overcome them that children with disabilities face. The available research indicates that despite progress on disability inclusion and humanitarian responses, there are still substantial gaps in implementation amongst those delivering humanitarian and emergency responses. More research is needed into why these implementation gaps exist, what are the institutional barriers to disability inclusion, and how to overcome these, including in relation to the effects on and inclusion of children with disabilities in humanitarian and emergency response. In addition, more research and dissemination is also needed on lessons learned from examples of disability-inclusive humanitarian responses. More is going on than is publicly available, but it is harder for the wider sector to learn from such efforts if they are unaware of them. Next slide, please. The lack of research looking at children with disabilities and emergencies is due in part to the methodological challenges of research in emergencies, which were just outlined by Israel, and also due to factors specific to children with disabilities. These include things like a lack of data disaggregation, which makes it difficult to identify children with disabilities and thus understand their unique experiences in emergencies, leaving them out of much mainstream research. Disability stigma means that children with disabilities are often isolated at home, sometimes hidden by their families. Emergencies often lead to displacement and disrupted social networks, which can lead to increased disability stigma, making parents less likely to disclose that they have children with disabilities, again, making it harder to identify them and include them in research. Even when caregivers are not hiding their children, the stressful situations they can find themselves in during emergencies and the traumatic effects that emergencies can have leave caregivers overwhelmed and less able to facilitate their children's participation in research. This is especially the case if the burdens of participation feel too much or they have concerns about risks to their child. Disability stigma and lack of contact with children with disabilities can lead to assumptions on the part of researchers or those recruiting participants for research about their capabilities to actively participate in research. This can result in children with disabilities being left out of research completely or their caregivers being asked about them instead. And researchers, whether program staff or academics, may have concerns about their ability to communicate and conduct research with children with disabilities that result in them being left out, especially if researchers haven't had disability awareness training. In addition, there are specific ethical and safeguarding concerns relating to research with children with disabilities, which, as Gavin mentioned, are the topic for another of these seminars, which is happening on the 6th of May, and which we can go into more detail about later. Next slide, please. So, as Maria noted, both academic research and research conducted by organizations working in humanitarian contexts, as well as qualitative and quantitative approaches, are needed to generate evidence about the experiences of children with disabilities in emergencies. One of the approaches, which I'll provide some examples of, are participatory approaches, which actively involve children with disabilities in evidence generation about their experiences in emergencies, in the spirit of nothing about us without us. Some features of these research projects include the following. So, a number of different research projects with adolescents and children with disabilities, and mainly those who are conflict reflected in situations of displacement, have used researchers with disabilities alongside researchers without disabilities. Focus groups conducted with adolescent girls with intellectual disabilities living in displacement camps in Ethiopia and Burkina Faso were co-facilitated by Self-Advocate, while focus groups conducted with children with disabilities in pre-primary education in Kakuma refugee camp in Kenya were led by peer researchers with disabilities who were trained in research skills. The presence of researchers with disabilities can help children with disabilities feel more comfortable. These researchers with disabilities were recruited through local organizations of persons with disabilities, who often also support in the recruitment of participants in the research conducted with adolescent girls with intellectual disabilities. Inclusion International's 2 local OPD partners helped identify the girls and provided the self-advocate facilitators. It's very important to adapt research methods so that they're accessible for children with disabilities. Methods often used with children with disabilities include the use of play, creative methods, stories, and role play. Research with adolescents with different types of impairments in refugee camps, informal tented settlements, and host communities in Jordan and Palestine adapted tools such as a favorite things exercise, body mapping, community mapping, vignettes exercises, to explore more culturally sensitive issues, including disability stigma. During research with adolescents with different severe impairments in Nepal during the COVID-19 pandemic, culturally appropriate pictures illustrating possible response options, dolls representing family members, story sequences, an emotions chart, dice, and number pencils were used as prompts to support the discussions. Some research with children with disabilities have been conducted with the involvement of humanitarian program staff, which has improved their awareness of and confidence involving children with disabilities in their programming. For example, the Adolescent Girls with Intellectual Disabilities project was conducted with International Rescue Committee staff members who afterwards said, "My attitude before and after, it's different. There was an attitude change. At first, I was struggling to communicate with girls, working with them, talking with them, engaging with them. I didn't think they would even understand me or what I was saying, but really, they just needed a little support." Women's Refugee Commission also worked with implementing partners in their research on girls with disabilities, which helped better include them in humanitarian programming. And further details about these projects can be found in the references listed on the next slide. Thank you.
Birgitta, thank you. Thank you so much for highlighting first the lack of focused research on children with disabilities and emergencies, but also emphasizing the need for more inclusive participatory approaches to overcome methodological and ethical barriers that we face, and a very powerful example there at the end. And thanks to all the speakers for hinting at some of the ways in which we can strengthen research on disabilities and emergencies. We are going to open into a discussion in a moment. As I mentioned, this is, we want to frame where we sit with all of this work through these presentations, but really spend the majority of our time having an open discussion. So again, please feel free, if you have questions, to pop them into the Q&A already. But first, before that, we have another audience poll, which will pop up on your screens any second. So in your view, so we'd like your opinions, your views, your experience. What are the most promising ways to strengthen research on children with disabilities in emergency and humanitarian settings? And you can choose more than one option. So the first, partner with local researchers and communities on field research. The second is recognize and integrate high-quality grey literature. The third, co-create research outputs and share authorship. Number 4, strengthen local research capacity and leadership. 5, make research findings, including grey literature, widely available. If you're listening in and with limited experience, you don't wish to participate, please still say, and there's an option at the end that says don't know, no experience. So if that's your case, please select it. It is anonymous, of course, so feel free to take a moment and pick as many as you think are relevant to promising ways to strengthen research. So I'll pause. Thanks. Okay, so thank you so much for that rapid response. I think there's a few and who have highlighted they don't have any experience. So we're really happy for you to have joined us today to also share the journey of learning together. Nobody had mentioned recognizing and integrate high quality grey literature, which grey literature also appears as the option making research findings, including grey literature, widely accessible. So 23%, nearly a quarter of you said that making grey literature would be a way of strengthening research on children with disability. By far the biggest, we have strengthened local research capacity and leadership, and also partner with local researchers and communities in the field. So I think this is a really important area that we all recognize across the field, is that research has to be done in partnership with local capacity, not just in the spirit of nothing about us without us, but just purely from that local engagement and capacity, which is indeed widely available in the field. And then about 2/5 of you, 38%, saying co-create research outputs and share authorship. So I think what's coming through here is partnering, co-creation, and strengthening local research capacities. So thank you so much for your feedback on that. We are now going to move into a moderated discussion, and I'll invite the speakers to that should appear on the screen and open their mics so that we can discuss. We are going to first go into a question which relates to contextual and operational factors. And I'm going to direct this first to Israel, but it's an open invite to others to answer here. So in Israel, in your presentation, you spoke about the unpredictable and unstable nature of humanitarian settings and some of the ethical constraints, access limitations, funding gaps that make research challenging. And you also gave us some real world examples, like in Borno State, where those barriers were creatively overcome through local engagement and even remote interviews and remote sensing, satellite imagery. So the first question builds on what you were saying there. So the question is, how do security risks, displacement, and unstable infrastructure affect data collection? And what opportunities exist for innovative approaches to generate reliable data? So I invite you to pick up from where you left off in your presentation, and over to you, Israel. Thanks.
Thank you so much, Gavin. And like I shared earlier on in my presentation, of course, the impact of security risk, displacement, and the unstable nature in humanitarian setting is very, very dynamic. You can't predict most humanitarian settings or emergency settings. So for the security risk, just like I mentioned, I couldn't travel. It might limit the ability of individuals or researchers from reaching the affected population and even sometimes having incomplete data. And more often than not, even in emergency setting, you might even exclude some of the people that may likely should have contributed to that particular research. For instance, the nomads among them, the indigenous people, and so on and so forth, or children with disability in rural areas where people cannot get access to. Another issue is the fact that in this emergency situation, displacement occur. Most of the population, of course, move away, maybe trying to avoid crisis. So it makes some of the research approach, like for instance, if you want to conduct longitudinal study, it makes it a little bit difficult and challenging. How do you track them? And just to say this, in my own work, one of the major challenges I also had was the unstable infrastructure oftentimes to even have access to phone connection was very difficult. Internet was something else. Oftentimes, I mean, it took me like almost 3 weeks to conduct some of my research in Maiduguri because there was no internet. The internet was down as a result of Boko Haram activities in that particular place. However, just to say this, I was able to overcome some of this, of course, using online methodology, you know, like using organization of persons with disability to mobilize themselves together, and also using technology as a whole, though it was quite challenging. And like I mentioned, we have had to use different online or mobile data collection tools over the years. Example of those tools are like Kobo Collect, ODK, and also remote sensing imagery report. And oftentimes, like Professor Maria rightly said of late, AI, I don't know, of course, ethical issue remain a major challenge in that regard. And one other thing I realized that we can also use in this particular context when you have these challenges is the need for us to engage communities. Back to the issue of ethics. Ethics is a major challenge, especially when it comes to children with disabilities. Like I mentioned earlier, I was planning to work with children with disability, but because of the ethical consideration, I had to switch over, despite the fact that I've gotten approval from the state government, the willingness of organization of persons with disability. But for my institution, University College London, where I'm currently studying as a Commonwealth PhD scholar, it was quite challenging. Even getting the ethical clearance for the project, the research as it was a major challenge. And so in operation barrier, of course, access restriction, like I mentioned, government oftentimes limit researchers from talking to certain people. And the fact that in most humanitarian situations, the timeline is also very, very short. You know, logistical constraints, you see it here and there. And oftentimes, though people say they have local capacity, but I was fortunate that I'd already built the capacity of some of the humanitarian actors while working in Nigeria about 4 years ago. So I was able to leverage on the local capacity of the people involved, partners, and even some of my colleagues in CBM where I'd work to be able to get this across. And just to share a brief way of how I overcome those barriers mentioned earlier. Of course, I work with the network of organization of persons with disabilities. And as a member, you know, there is these alliances that we have, or solidarity that we have among ourselves as persons with disabilities. We always like supporting each other wherever we are. And there is this popular saying, we also believe that there's nothing about us without us. So when they saw me in, they were so happy. Some of the things they were able to open up about, they wouldn't really open up to other researchers without disability. That talks about what Bridget talked about earlier on about, I mean, co-creation, you know, co-designing of research by organization of persons with disabilities. And also other approach that we can use, of course, in overcoming some of these barriers would be the use of maybe satellite imagery, decentralization of data collection tool. So I will just stop here for now, and thank you so much.
Thank you, Israel. No, that's really interesting. It was fascinating to understand maybe a little bit more, but perhaps a little bit later on, given the Wi-Fi internet connection, things were down and you were reliant on some of these tools, how you really overcame them. I wanted to also, and Brigitte and Maria, please also feel free to come in on this, because you touched on some technologies. So the other question I wanted to ask is, what operational barriers frequently arise in humanitarian research, and how might research, you mentioned local partnerships, or technology to overcome these challenges? Could we dive a little bit deeper in some examples as to how those technologies can overcome some of these barriers, or how you can leverage these local partnerships? I don't know who would like to go first.
I can have a go if you want. I just wanted to come back to something Israel said, because I think it's related. So even if you are from a place and you're here doing your research, let's say in the UK, you're based in a UK university, you have to do a risk assessment. And so Northern Nigeria, according to UK Foreign Commonwealth Development Office, is a high risk area and advising against all but essential travel, which invalidates your insurance. So a risk assessment in that case is not, no university is going to take the chance to send a student there in that situation, which I think is really interesting, because the implications of that is, as you've rightly said, Gavin, we can work with local partners. Well, is it right that local partners should be put in such a high risk context in that context? So it raises lots of challenges about ethics around whose safety and security. Obviously, of course, there are still universities functioning in some parts. I'm not so sure in all of the parts in Israel, but do come back about that. So I think this is one thing we have to think about, particularly in humanitarian context, is about the appetite for risk and the level of risk, and what that, who's going to take that risk appetite, and what the ethics of that are. More broadly beyond, because it's a two-way process, the ethics about doing research with children, ethics of doing research with children with disabilities and their families, but also the ethics and the security and safety of the researchers going into the field. And I think that's where some of these challenges and some can come unstuck, to put it mildly. And these are really difficult challenges. I was talking to colleagues at ELRA to get some examples about some of the research they've been doing, and they funded, for example, a research project in Gaza literally 2 or 3 days before the war started. And so, understandably, the research in Gaza, which was led by a DPO in Gaza, they don't want to do research on whatever they were going to do it on. They want to get life-saving assistance to people in Gaza. So they wanted to pivot the research. And I can, we've talked about this already. You can see how that is really important to people, but on the other hand, if we don't know what happens to people in those immediate situations, we perpetuate this problem that we don't have enough data and evidence to show what happens to people with disabilities. So it is a challenge. So some of the sort of tools and things, Israel's touched upon remote, doing sort of remote data collection using testimonies, doing retrospective data collection. I mean, the humanitarian sector has had many debates about using retrospective mortality data. These are things that we know we can do retrospectively. So there is, I think, some evidence of that. Some sectors, for example, collecting health data, that I think is, we can do that in an emergency. That can be done at a hospital level. And again, working with partners, local collaborators, to really ensure that we have, data's collected, it's how it's used. We have to be respectful. We have to ensure that people feel comfortable and that their priorities and are being listened to, and what they think are the more important things. And this is where I think I'm not sure we're going to solve that issue directly today, but I can there are of course lots of sort of digital tools and things to try and help overcome this. But I think these are really big conundrums, and it'd be great to hear if anyone on the call has got any thoughts or suggestions how they might have overcome some of these challenges.
Sure, thanks, Maria. I mean, this brings us, Birgitte, I wanted to pivot it slightly because it's related, and I think you've started touching on, Maria, the ethical considerations and some of the methodologies. Now, Birgitte, in your presentation, you outlined how research with children with disabilities often suffers from methodological limitations, and you mentioned lumping data together from adults and children with disabilities, or excluding children entirely. And you also discussed how stigma and disaggregated data gaps and researcher discomfort and around these methodologies can lead to ethical dilemmas and perhaps weak conclusions. So it's sort of building off on the same point. So could I ask you a question, which is, what are the main ethical concerns when conducting research with vulnerable populations? Making note that our target audience here is children with disabilities in emergencies. And how can addressing these challenges strengthen research quality? Does it strengthen the quality? So over to you. Thank you.
I mean, there are a variety of factors in this, and also just building on, I think, some of the things that Israel and Maria mentioned. For example, like perhaps it's an ethical concern that a lot of the methods used in emergencies are remote technologies, yet there is a digital gap faced by people with disabilities, especially children with disabilities. Like, it's very hard for them to access mobile phones because their families live in poverty. Maybe the technology is not accessible. So that's something that needs to be thought about, and is perhaps why a lot of the research that's being taken place in emergency situations is often in displacement situations. So it's after the immediate emergency, where people are sometimes a little bit more settled, and then perhaps have access, researchers can have access to them because they're in the one place, or the there's a technology's been set up because it's not in the immediate disruption. So for example, they might be able to go to an OPD who has technology that you could use and things like that. So yes, ethical concerns of vulnerable. I mean, you are working with populations who've been traumatized. So the research you need to do needs to consider the fact how you make sure that they aren't re-traumatized by what's going on, that it's beneficial to them. And especially for children, you need to consider safeguarding concerns, because in emergency situations, the safeguarding risks to children with disabilities often increase because they are in new environments, especially that like the deterioration of their social networks all places them in a more risky situation, especially seeing as how they're often quite reliant on their caregivers. The stress of their caregivers can also increase these factors. So when you're doing research with children with disabilities in these situations, you need to have quite robust safeguarding procedures. And that can be done in conjunction with by working with humanitarian organizations which are working on protection issues, by working together with OPDs on developing these safeguarding procedures. Also, you're talking, depending on what you're researching, if it's a very sensitive issue, you need to think about, is it appropriate to ask these questions in this situation? Are you going to make things more risky for these people? So like really considering all those factors as well.
Thank you, Birgitta. And yes, that we just as a heads up, for as you mentioned, I think on Tuesday next week we're going to dive into ethics more deeply and looking at safeguarding also. I want to sort of bring back a little bit. So Israel, this bring you in because you touched on remote data collection. You particularly talked about remote sensing and but also on participatory methods. So this is a question for you and Birgitta, I think initially, is how can innovative methods or adaptive research designs overcome some of the constraints in humanitarian contexts, such as limited baseline data and disrupted populations?
Thank you so much. While I must confess that not all the solution is embedded in technology alone, but technology have gone a long way in helping us out. A practical example of what happened, to me, while working in Nigeria and even while studying here in the UK, was the fact that when we're trying to get a baseline data for a proposal that we're developing in humanitarian setting in Northeast region of Nigeria, we decided to send enumerators using Kobo Collect, to be able to gather data. We have quantitative data to know the number of participants. And that was very, very helpful for them to go to IDPs and to also visit some refugee camps, because if you look at the map of Nigeria, we have refugee community from Cameroon, and also we also have IDPs in Nigeria as a whole. So they were able to reach out to those community with Kobo Collect by using their smartphone, and it was helpful. It enabled us to gather the baseline data wherewith we were able to develop our proposal. And for me, the internet was like a saving grace for me, using Team to reach out to so many of my participants across different parts of Borno. I even extended, my supervisor is here, Professor Maria. I extended my research to talk to people in Gaza, in Afghanistan, in Ethiopia, by virtue of using technology. So technology helped me significantly. And another research that I'm aware of that we did while I was in HI in Ethiopia was the sexual reproductive health in the humanitarian context during COVID among adolescents. It was published in Ethiopia. And we used a lot of focus group discussion online and also survey methods. So these were some of the areas where we were able to leverage on and overcome some of these challenges in terms of using technology to be able to conduct research appropriately. Thank you.
Thanks, Israel. And as I noted, we have delighted to see that there are a couple of people participating, at least, who are perhaps new to this space. So could you just, in one sentence, just describe to us what the Kobo toolkit is and how it works? And does it work offline from the internet, or does it have to have a connection?
Well, technically, it doesn't need to have network connection. You can just use your phone. Look at my smartphone. Okay, I'm using smartphone. You have a way of recording it even when you are offline. So, however, when the person switches it on, it sends the whole document to the central server, where you'll be able to collect all the data that were collected from the field. So it's a very, very good tool, more like a questionnaire kind of tool on your phone, on your smartphone. Even common phone can make use of it too. Yes.
So SurveyMonkey for the field, it's a very powerful tool, and I really, really appreciate that. I just wanted to let people online know this, because it's often used a lot in humanitarian settings just for programming work and things like that. It's a very popular baseline. So if you're not aware of it, take a look at that, and it's open source, so I believe you can just access it. Birgitta, I don't know if you wanted to add anything to that question. Feel free to come in, or Maria. Okay.
Yeah, sure. So I guess one of the ways which we mentioned was this using participatory methods, and then they're often done in conjunction with organizations with people with disabilities. I mean, which is a very important way of working, although we also need to be aware that often these organizations might have limited resources. So the researchers need to provide those resources, including training in research skills and ethical concerns, for example. Conversely, you can also make program staff more disability aware, and therefore able to include people with disabilities and children with disabilities in the research. And that can be done in conjunction with partnerships with OPDs. And I think that partnership element is a very important part of doing research in these areas. I think one thing to note, though, in relation to children with disabilities is that they might be less linked into the OPD networks, depending on their caregivers' attitudes towards disability. Because if disability stigma is quite great, they do hide their children, and therefore they might not want to link to organizations of people with disabilities because they don't want to associate with that. So then I think that's why often it's easier in places where people have been settled for a while, because those relationships can develop. The OPDs can go out into the communities and find the children with disabilities and so on. So yeah, those are just some of the issues I thought I'd mention.
Thank you, Birgitta. Maria, you were nodding before.
I thought I just wanted to sort of just underscore a couple of things that Israel and Birgitta have said. I think it's really important. We often talk about researching with DPOs. There are plenty of precedents of this that have been, I mean, plenty. There are precedents. You know, certainly we worked on a large scale Bridging the Gap project. Prior to that, there was the DFID funded Knowledge Action and Research Programme, all of which were led by OPDs. ELRA have funded a project in Mozambique called Data That Matters, which is using AI to disaggregate data collected actually by Kobo Toolbox. And large part of the team that were collecting the data were persons with disabilities who were trained to use the Kobo Toolbox data. And that actually has had really positive response from the communities in a very forgotten crisis actually in Mozambique, where people with disabilities, as you rightly said, Israel, feel much more engaged when they see other people with disabilities. But I think I would caution a couple of things there. Not, you know, probably membership of OPDs is probably 10 to 15%, according to some estimates, of people with disabilities. So it's one entry point. Of course, OPDs will have their own priorities. They may not and are often not child focused. And when it is child focused, it tends to be on education or health, which of course are necessary. But I think we need to think a bit wider about children's resilience, children's capacity. Somebody's asked a question about that in the box, I can see. So I think that's a really important point to note when we're thinking about those partnerships. So I would say as well to think more creatively in those partnerships, you know, working with more child-focused organisations to really ensure that their work has a disability lens. And I think that's something we need to be much more creative. There are unlimited examples of very creative use of artificial intelligence, for example, even doing nutritional assessments. So looking at facial recognition of children to understand predicting malnutrition in children. So AI is certainly a really innovative tool, and I think we've touched upon some of its uses here, but what I would say is yet in the big world, AI is still, there's no framework of ethical AI. There's a lot of debates about huge amounts of data being a relatively small number of companies who own it. And that gives those companies, and we know who they are, huge power. And I think we haven't, that's not just a problem for the humanitarian sector, not just a problem for research, but it is an issue that's, people are thinking about and are having lots of discussions and debates around. And I think we need to be really, it's not just collecting data on Kobo toolbox, it's a whole raft of other issues that using artificial intelligence and digitalized data bring in. And I think you also said this, and I certainly mentioned it at the beginning, these are data trained on usually American populations in the, in a rich country, and often don't include humanitarian context. So again, we will just perpetuate that exclusion if we rely on that data. And finally, and this is a really important point, I think we are starting to reify this data. We need more data. We do, but I think we need to be cautious about what we want the data to do. Sure. The humanitarian sector collects enormous amounts of data every day. Think about the IOM displacement tracking matrix. I've had many conversations. The volumes of data we collect, we are doing needs assessments. What's often not done is that data isn't being analysed, or it's not being used. And the implications, as I said, of that, particularly for children and children with disabilities, is often not explored to its fullest potential. So I would say, do we need more data, or do we need to be doing better with what we've already got, and really thinking about what the implications of the already existing data are showing us, and understanding and interpreting what it is. So yes, we do need more data, but I think, we need to be very clear about what we want to collect more data from. I will get off my soapbox now, Gavin.
Thank you so much, Mary. Well, keep your mic open because of this. This sparks a question, actually, because you started there talking about capacity and coordination, and doing better at connecting. And so there's a question I wanted to ask a bit later, but I'll bring it in now, because you made a strong case also in your presentation for move towards co-produced, transformative, and you're touching on your response now, and emancipatory research. That kind of work, however, depends heavily on capacity and coordination. And as you just alluded to there, there's a lot of capacity in the field. There's a lot of data being collected. Is it the right data? A lot of aid agencies collect a lot of monitoring and evaluation data, and it's not necessarily connected. One of my frustrations is that, like you, there's lots of data, but we're not necessarily using it. So in these limited settings, how do limited research capacity and expertise in disability inclusion constrain humanitarian research? And could you go in a little bit more detail on what are the opportunities that exist to strengthen capacity through collaboration and training?
So maybe I'll start with that one because it seems easier, to believe it or not. I think one of the biggest opportunities is exactly understanding, I am constantly amazed when we have conversations with humanitarian organisations. So that, yeah, we've got these research questions. It's just asking, sometimes it's just being aware that there's a whole raft of students that want to do master's, dissertations. There's lots of opportunities to come to we need data. We're researchers. That's what we use data. So maybe more connections between academia and the sector would be beneficial. I think there's still a relatively few points of connection there. So that's, opening those avenues for dialogue. For example, we have a humanitarian institute here at UCL. We've had some really interesting conversations recently with an organisation, and they've got lots of ideas that they could really want more research in, that would, having academics will enrich their research. It might also frustrate them in ways that they have yet to discover, but that's the reality. And then that second point is, I think as researchers, I can't think of a single project I've done, let me not be found out, that hasn't involved some kind of collaborative partnership with people in the countries that we're working in. We can't work without doing that partnerships. So that's really clear. Sometimes the funding dictates the level of money that can go to that partnership. That can sometimes be a requirement of the funding. It can be a constraint of the funding. It can be a constraint, for example, if the organisation have a relatively small capacity and can't accept a large amount of funding. So I think really building those collaborations and establishing them and building on them, and really, capacity building doesn't happen, much as some people might think it's a 6-week course. It's not. It takes time to build up those relationships. Both Israel and Brigitte talked about trust, building up trust, building up that, you know, real sort of long-term knowledge and really understanding the context. You know, I've worked in many places, but I'm not, you know, people who live there experience that every day, are the experts in that field. But we can work together to, you know, unpack ideas, share research techniques. And that, I think, takes time. So it's really having those longer, and that, I think, is a source that needs to be, perhaps, whether it's funding sources that need to be thinking a bit more about how they do that. You know, it's been an area that probably has been underfunded in research funding. That's clear. So I think building up those relationships, really building up capacity. And the final bit, I think, and this is the contentious point maybe, disability hasn't been one of these sort of areas that people want to get into, nutrition or, you know, emergencies writ large, but actually, you know, working with partners in country, really getting a much more engagement on disability issues at partner level in the countries, I think, is really important, both within academia and, of course, within the organisations themselves, but really building up that capacity. And I've seen some really positive examples where that's happened, for example, in Uganda and Makerere University, where really the capacity is now excellent. You know, there are other examples where that's also been the case. So I think really just good trust building, really continuing the relationships, building on them, and really, you know, building up that mutual respect and collaboration.
No, thanks, Maria. I appreciate that. And this makes me think then also of a related question from the other side, from funding, is related to the dynamics. There are funding constraints in terms of lack of funding, but also constraints in terms of the ways in which funding is earmarked for specific things. So this is a question to all to think about. We've only actually got 4 minutes left of this session, believe it or not. But I want to go back to Maria first on this, and then others, please come in. Birgitta, please come in afterwards, which is related to what extent do donor priorities and funding limitations shape the type and quality of research conducted? And how can evidence, we have limited evidence, but how can evidence help to shift these dynamics? It's a bit of a chicken and egg question.
It is, isn't it? It really is. I mean, I think this issue about what donors want to fund and priority areas, we can see that can be influenced. You know, I work in the UK, so I can see the UK funding, you know, scene can be influenced by what's, you know, globally relevant, or, you know, climate being a good example. There's a lot of funding available for research around climate now, which perhaps wasn't the case, you know, 2 decades ago. I'm talking about the social impacts of climate change. So I think that it can be influenced, and that's partly our responsibility as researchers, but also our responsibility of, right, you know, lobbying politicians, etc., to really try and shift that agenda. But that still means the funding sources from the richer countries. So you know, how do you shift that balance? I think is a much bigger and more complicated question. Certainly, I think the EU have been relatively, you know, open about where they're funding. But again, you know, it is about lobbying, about asking, you know, people to work. Birgitta alluded to this. You know, there are some humanitarian contexts that are slightly, I want to say easier, but I use that term, long-term displacement being a good example. You know, it's a relatively static population, not static, but they're in one place oftentimes, so there's a possibility to work with a group for a longer period. I mean, there is some good research out there. Getting that into the policy space and getting it into the humanitarian space, I think, is more challenging. And as I said, perhaps different mechanisms to do that, exhibitions, photos, whatever, to really try and get that awareness about those findings back in. And then that opens up a dialogue, because I think it has to be a dialogue. You know, you know, it's this issue about funding and dynamics and power are very live, as you well know, Gavin, in the broader sector. And I think, you know, these are, you know, always children, and always children with disabilities are really at the thin end of that wedge. And so the wedge is quite thin anyway. So there's even less for that. So, you know, we really need to have those discussions and really push that agenda to the forefront, I think.
No, thanks, Maria. I just want to ask Birgitta if you wanted either to add something to that, or to maybe bring something back in around participatory engagement, and whether there's any opportunities there to influence funding to make it more, so it's tackling issues at the field level and making it more grounded, so donors perhaps can understand what the impact really is, rather than it being too disjointed. But feel free to sort of chip in on that, or any other points you perhaps wanted to make. And I'll invite Israel afterwards to maybe say a last few things before we move into the open Q&A. So Birgitta, please, over to you.
I think that one of the points I wanted to make is that it's important not just to involve people with disabilities in data collection, but also that next stage, the data analysis. And if they're involved in the data analysis, then they've got more ownership of that research, its implications, and that can also be used then in their advocacy work. And I think that advocacy work, as Maria was saying, it needs to be happening at multiple levels. So in donor countries, there needs to be advocacy aimed at the donors, at the mainstream organizations working on it. But also within the countries, it needs to be aimed at like national government, at the humanitarian organizations operating in these places. And if people with disabilities have more information, especially evidence, which often has a bit more weight placed on it if it's considered like research, through their analysis of it, they can use that to put pressure on and highlight the importance of their experiences and where it's working, where more is needed to overcome the barriers that they face and things like that. So yeah, so we shouldn't just be talking about involving them in data collection, but also in the analysis of the data.
Sure, and in the co-creation, I think we talked a lot about that at the beginning.
Yes,
So
from
right
the
the way
beginning,
through the whole piece of and how do we position ourselves into that journey as a really important perspective, as opposed to this sort of helicoptering in and seeing how we can include them. It's how do we support them? I think it's important. We are out of time.
Trust and time and
No, exactly. And I'm just mentioning that because you mentioned that in your presentation and your other answers, and there's maybe some time to unpick it a little bit more before we do close. Israel, just maybe if there's one or two things you want to say before we move over to the Q&A, and before you do, I'll just ask all of you online, if you've got questions. We have two already coming in. If there's questions you want to ask, please put them in into the Q&A. You'll see that at the bottom of the screen, or you should be able to navigate to it and put your questions in there. So please go ahead. Israel, please.
Oh, thank you, Gavin. And just to, follow up with what Brigitte has said, it was because of lack of data that made me to advocate to the British High Commission back home in Nigeria in 2017 that they've not been including persons with disability in humanitarian response. And you can see, as an advocate myself, with little evidence or no evidence at all, it can also be an opportunity for us to use that to influence research in this area. And as a result of that, we are giving a funding while working in CBM, which we did a lot of research on that, though of course it was NGO-led research, but it was of good quality. And it was able to influence the policy within the British government. Then it was DFID before they became FCDO. And today, they've included persons with disability in their humanitarian interventions across the globe. Thank you.
Great. No, thanks, Israel. That's really, really important points. We have another audience poll we'd like you to participate in ahead of you writing some questions. So please don't be shy. I'm sure there's lots of questions, or even indeed, as Maria invited you, if you have any insights and answers to any of the previous questions, and also please put them in there. But the poll, first, this is what types of participatory methods ensures meaningful engagement of children with disabilities in research? This is a single choice. So the first one is child-led or co-designed research approaches adapted to local context. Use of accessible creative tools, drawing, storytelling, digital media to support expression. Or the third option is partnerships with OPDs or community facilitators to ensure ethical, inclusive engagements. So we see that last question also as local community leaders, for example. So what type of participatory methods ensures meaningful engagement of children with disabilities? Child-led, accessible creative tools, or partnerships with OPDs and local community leaders? So we'll see this closing shortly. And I'm imagining, yes, I was imagining a little bit of a spread across all of them, because of course they're all relevant and they're all they're all important. So it's a bit of a difficult one to choose from. But the first one that came out top, 45% use of accessible creative tools for storytelling. So I think this speaks a lot to the participatory approaches taken. So when we talk about participatory research, what do we mean? How do we actually participate? And I think these accessible creative tools. And here, of course, recognizing that all children with disabilities are very different, and depending on their impairment and severity, the approaches to which you might take to doing these things will have to vary also. But child-led or co-designed research approaches adapted to local context, about a third of you said that would be your choice of taking it forward. So we'll close that. We are open. So we have, as I said, we were dedicating specific time to answer the questions that you're bringing. We see two at the moment in the chat. I'll read them out just in case the speakers can't see them, and also for the sake of everyone online. So the first one is a general question. I think we might know the answer to this. Are there any studies that have demonstrated the evolving capacities of children and young with disabilities to self-advocate in humanitarian settings? So when we use the word evolving capacities, we mean the child is growing, they have greater agency as they get older, and as they get older, they should be engaging more directly. So that question relates to that. I don't know who wants to open with thoughts on this. Israel, you've opened your mic, so thank you so much.
Well, thank you. Of course, we've talked about the fact that research focusing on children and adolescents in humanitarian setting in emergency is very, very scarce. However, I think I'm aware of one, though it was on reproductive health, that was done recently during the COVID crisis, the impact of COVID-19 on adolescent girls. And it was done in Ethiopia. I alluded to it earlier on. And the beauty about it is this, though it was done during, of course, COVID lasted between 2020 to, or we still have it ongoing. But then these girls, these young adolescent girls were able to contribute from their own perspective, and they used that as an advocacy tool to engage other stakeholders in humanitarian setting. And it became a national thing in Ethiopia then. I was working in Addis Ababa, and people were like, oh, nobody thought about the challenges that young girls with disability faces when it comes to menstrual hygiene, wash related. And as a result of that, we work in the NGO sector, then we were able to design our program to target them so as to meet some of their needs within that period. So that's the only evidence I know of. I don't know if Professor Maria or Brigitta has other example of studies to buttress this fact too.
Well, thanks, Israel. I mean, yes, indeed. I mean, I didn't mention that here at UNICEF Innocenti in 2022, we did an evidence and gap mapping looking at inclusive interventions for children with disabilities. And the predominant area of research that was taking place was, even though it was very scant, was pretty much in the health sector and in education. And everything else was quite limited. And when we looked at humanitarian settings, it was about 2%, which actually was, and that wasn't really speaking very strongly. So I think the general answer, you're right, Israel, is that there's just a paucity of research in this area. And if I may also use this is my soapbox, I think the question came up and Maria was talking about AI. If we think about large language models, this just points out the danger that if you use AI to try to answer questions in this space, it's just not going to give you anything meaningful because there is no research. And so I'm just advocating that people don't give up on research and really focus on generating that evidence that we can hopefully push back in the future into these large language models that may or may not then be helpful to help answer some of these questions. But Birgitta, you unmuted, so please, over to you.
Yes, so I think there's less evidence in humanitarian settings of children with disabilities being leading the researcher. Often there might be researchers with disabilities involved, but it hasn't tended to be children with disabilities themselves. However, the studies that I mentioned from Women's Refugee Commission, the work that they did together with the International Rescue Committee, they were participatory action research projects. mainly focused on gender-based violence programming in a variety of displacement settings. And then within those projects, the girls with disabilities did become self-advocates as part of that project. They gained confidence, became a lot more engaged with the different programs in the community, with also other spaces within the refugee community as a result of that process of research which they went through. So if you can if you look up Women Refugee Commission's work with the International Rescue Committee there, you can find some examples of that.
Thank you so much, Brigitte. We have another question. I mean, Maria, I don't know if you want to come in. We have another question, but feel free to jump in. But this next question. So you touched on this actually, Maria, about intersectionality. So for those maybe new to this space, intersectionality is one of those words that's overused, but it's an important, very important aspect, which means that nobody really identifies as one thing. We have many factors, and it's not just how we identify, it's who we are, where we are. So there's a question here which relates to this intersectionality. So the question is, what can be done to really highlight or encourage looking at disability as in an intersectional way, even with just gender? So for example, girls with disability is already a step forward to being a bit more specific, but also some other issues, other factors named here is age, race, location, migration status, etc. Poverty status will be another one. So Maria, do you want to come in and give this one?
I think I link it a little bit to the other question as well, maybe. The first thing that I want to say is increasingly now in humanitarian settings, I think we are better, or they are better at collecting sex, age and disability disaggregated data. Not exclusively, but there's some requirements of certain donors, etc., to report on that. Again, I come back to the point, report on it, but actually doing anything with it is another point. And I think it's very hard not to see these in separate silos. You know, I was a disability focal point a long time ago now for the SPHERE standards, which are the humanitarian standards. And at that time, I think we were 19, and I think there's probably about 26 now. And, you know, each of us has our own area: disability, gender, gender-based violence, mental health. And it is very hard not to, you know, I teach a whole module in intersectionality, and, you know, we have to have things, it ends up being a week on gender, a week on age, a week on disability. It's very hard not to see them in these silos. But as I said earlier, one of the ways I think we could do this, and I haven't seen much evidence of it being done yet, is really understanding how this impacts children across the life course. And I think that would also help with this evolving capacities and really understanding, following through at cohorts of children. And that will then bring in all those location, migration, other caste, class, etc. statuses, and really understand how that impacts on other aspects of children's lives. And it requires some complexity. A lot of cohort studies or longitudinal studies are done on large cohorts. The one, I mean, the one people will perhaps know most about is the Oxford Young Lives project, which has been following a large cohort of children over a number of years now, including children actually who are affected in humanitarian contexts. So there is that project. But I think this really sort of following through and understanding, rather than trying, it just shifts the emphasis rather than on the thing, disability, gender, it focuses it on the child. And we talk about child-focused work. And I think that then we need to shift that perspective. I don't know that it's going to be the easiest thing to do. And I'm for sure, you know, a lot of children will be lost, movement, migration, etc. So it's not going to be easy. But I do think it's one of the ways we can really try and understand those intersectional impacts across a child's life. And as a child does, you know, evolve and grow up and become a self-advocate. So, I mean, I don't have any good examples where it's done well yet, but it's certainly an area that I'm interested in and I'm, you know, working in. So it's certainly something that, you know, I hope that we can do, but it is a challenge. And I think this is a really, you know, important point, because even when we do collect those additional characteristics, as I keep saying, it's understanding what the implications of those in that context. What are the implications of being that age, that race, in that location? What are the implications, and really understanding how that unfolds out and the impacts of that over time. don't think we've got that good at yet. But Brigitte, you might remember that there was more than I will if we had any papers in the background report on any of this. I don't think we did.
No, I mean, like, I think that was something that came up in the background report, that intersectionality isn't really something that's covered or yet done very well in the research. And it was also something that the ERLA gap analysis also noticed, that intersectionality really, it's something that we need to do more work on. And I think not just in relation to age, race, location, migration status, but also impairment type, because often everyone is lumped together, even if there are differences in their experiences. Yeah, so that's also something that still needs more work.
No, this is an important point. I'm maybe going slightly off piste here a little bit with the questions, so brace yourselves, because it really sparks this question. I'm just putting a few things together that we've talked about already. So one was, and it links to these two questions that are already here, and please add some more questions online. This idea of the need to have longitudinal studies. If we look at intersections, and if we just talk in a more meaningful way, so we talk about children with disabilities and comparing boys and girls and the opportunities that they have and the barriers that they might face, and whether they're in a migrating setting and whether they've come from a poor background versus someone that might be a host from the host community, and put it into a real context. Those are the sorts of things I think most people mean by intersectionality, and it gets rather abstract if we just talk about intersectionality. I'm just curious to what you thought. If you were to put together a project, and I have a bit of think about this, but how would you go about setting up a project that starts to look at maybe over the next 10 years, because we have, of course, children with disabilities arriving in an emergency context. They may stay there. They may be in a protracted setting, like in Jordan, in camps, they've been there for generations. In other cases, they're there. It's an early onset flood. They're displaced. They go back. So I know contexts are different. What do you think and maybe Brigitte, based on your experience of these gap analysis and reviews of the work, where should we be focusing our efforts to have a big impact if you were to be given a nice pot of money? And this is open to everyone to answer. And if you're not quite sure yet, maybe I could ask Maria to start just by maybe saying a little bit about the Oxford Young Lives Project, because you'd mentioned that, and maybe that's just a bit of, if you could just describe what that is, and it gives our colleagues a bit of time to think about the question.
Putting me on the spot. It's a long time since I've engaged with it now, so I can't quite remember how many countries or how many children, but it's a very large project. Just to be clear, I did say longitudinal, but I mean life course. So looking across the life course, it doesn't necessarily, there's a difference. Sure. Longitudinal is slightly different to life course. So basically the Oxford Young Lives Project takes a cohort of children, I think it's in about 5 or more countries, I'll find the website in a minute, and they basically follow up every year or 2 years and ask the same children questions about their lives. And sometimes there are sub questions within that they go back and ask specific questions around COVID, would be a good case in point, and follow these children through. This is something that's done. There's a TV program in the UK called 7 Up, which has been following children through every 7 years for decades now. And it's interesting because it gives you a sense of how over time people lives change, and at different points across the life course different things are going to impact you. You're not going to worry about employment necessarily at the age of 6, but that will start to change. You'll start to think more about that as you go into your teens. And so it's a really interesting way of understanding how those issues impact, and then bringing in, as Brigitte said, it could be impairment type, religion, gender, how they intersect. So I think for me, it's an interesting way of trying to do it, because I think otherwise it divorces it from context, and it's a way of really trying to understand that. And less sometimes I'm thinking, you mentioned Jordan and Bangladesh, and we did a piece of work around access to assistive technology in Jordan and Bangladesh. It wasn't particularly child specific, but what really struck me, in 2 things really struck me about that piece of work, and these are very long-term displaced communities. One was the provision of assistive technology is often completely divorced of the context. So people are given wheelchairs, but in Bangladesh there's huge slippery muddy hills. how, you know, how are you going to go anywhere? How do you get to school? How do you get to work? And I think without thinking of the context within which we're doing this work, it doesn't. So this is where we need to be much more joined up and bringing things in a much more joined up to, you know, and perhaps that's the point about disability. You know, if we don't try and think of it in a part of a wider picture in a much more holistic fashion, we're giving people things that might help them to a degree, but they're not really going to achieve enable people to be and do what they want to achieve. And I think that's something we need to be very careful not to avoid. I'm not sure if I've gone massively off the subject there yet, but that's what I would start to look around if I was doing a project. Really, you know, it's hard because you will lose people across, you know, they'll move and things, but that you have to have a big enough number to do that. And, you know, I'm an anthropologist. Ethnographic approaches is our life source. So I think that's, you know, really, again, as I said about building up relationships with your research partners, it's also with the people you're doing the research with, not to, but with. And it's really building up that trust and that collaboration. And, you know, in the end, people are participating out, you know, they want to feel that it's going to benefit someone.
Sure.
And that's,
Thank
you know,
you.
really important.
So, Birgitta, thank you. You've opened your mic. Please go ahead.
Yes, and I think like building on that, I think like, yeah, it's important that you do research that's long-term, and I would argue that it's also would be important to do participatory action research with children, like with disabilities, bringing them together, creating the connections with them, building their confidence, their solidarity, realizing that they're not alone in these terrible situations that they're in, but also that they can make change. And yeah, looking at that, what they can do, and what difference, because research shouldn't be just done for research sake. It should be done to make a difference. And especially for looking at children with disabilities and the situations they're in emergencies, like change is definitely needed, and they can be part of the change. And I'm thinking about like a big research project that colleagues of mine did looking at child labor in Bangladesh and Nepal. There were child-led action groups, and being involved in that research like really helped change the children with, I mean, I'm not sure how many children with disabilities they had. I think it was mainly children who weren't disabled, but it made a difference to those children's lives. Maybe not dramatically, because you can't change that much, but you can change a little, and even a little is important. So yeah, I'd argue for some long-term participatory action research projects with children with disabilities.
Right. Thanks, Birgitta. I think, yeah, it'd be interesting to share. I mean, I think that the Oxford Young Lives project, that sort of is an interesting one. I think one of the questions we were grappling with, there's two questions, two sides to research. So coming back to your point just now, Birgitta, about research should have a purpose. There's what is the impact of humanitarian emergencies on children with disabilities? You know, there's that whole angle. Is it having an impact? And is it different to all children? And this is where intersectionality is important, because it might impact girls more, it might impact a certain group more, it might not, in fact, certain types of impairment. There was an example in Gaza, you know, where preparedness actions were not taking into account children with disabilities, and there were a number of children in wheelchairs that couldn't access, they were on sand and they just couldn't move in the way. So there's all these things. So the intersectionality is really important, because I think it allows us to make research child-centric. So, I mean, I think, so that one, what's the impact of humanitarian emergencies on children? And then what is the effectiveness of doing disability inclusive humanitarian action? So the guidance that we in UNICEF produced, I think we talked about this in the past, that there hasn't really been any studies that look at the impact of that kind of inclusive humanitarian action, and is it making a difference? And do we need to do things differently? And if so, how do we? So I think this is really interesting. And this, if we can, we'll try and share this link to the Oxford Live project as perhaps just a conceptual framework in which something could be fleshed out. Israel, I wanted to bring you in case you wanted to say something or add something to this. Feel free to decline also. You're on mute, Israel.
Thank you so much, Gavin. While Maria and Vijeta were talking earlier on, one of the thoughts that came into my mind is the fact that we need to involve caregivers of children with disabilities in all this research too. And their teachers. I remember some INGOs are doing quite a bit on that. They've done research, but I don't know if they've published it. I remember Plan in Nigeria. They've given space to young girls with disabilities to be able to like express themselves. But at the same time, they've also involved their caregivers. Because oftentimes in humanitarian situation, the caregivers are diverse. You know, some of them may be orphaned, some of them may have lost touch with their parents, and they're just child-led household, you know. So one of the things that they did was to target them and to conduct a research among them, to hear their voices, to hear their preferences. So if I were to do a research in this regard, I mean, one of the things I will be thinking is this: I want a child-led research appropriate for different age group, because of course, depending on their age grade, you know, we can do a research focusing on adolescent, we can do a research focusing on 5 to 10 years old, using creative method to do that. So that would be my opinion.
Okay.
Thank you so much. Yeah, thanks.
Thanks, Israel. And Brigitte, you were mentioning there in your dream project, a long-term participatory project. One of the questions we were going to ask earlier, if I could bring it in here to you, is how can researchers effectively use participatory methods in humanitarian contexts without burdening the affected communities, creating opportunities for genuine co-creation? And I would add, and also managing expectations and not creating a false hope.
Yeah, I guess it's that building up of trust, and also importantly resourcing them to do it and making sure it's something that they're interested in and see the value of, that it's co-created, and that does require resourcing and capacity building, because they have their own priorities in challenging circumstances. So researchers can't expect that that they're going to be more interested in what the researchers want to do. It has to be something that they want to work on together, and really acknowledging their and valuing and reimbursing them for their contributions.
No, thank you. And Israel, you've raised your hand. Please go ahead.
Yes, thank you so much. Just to say this, I speak as someone with disability and I've worked in that space. Oftentimes, we look forward to researchers talking to us, asking us about our perspective, because in most research that I've witnessed over the years, we've talked about it, they tend to ignore us. So it's a privilege when we see people coming to talk to us as people with disability, be it children, young adolescents. I can tell you the excitement that that happened when I told the leaders of persons with disability in the Northeast that I'm coming to conduct a research with them. They were so happy about it. They said this is the first time somebody is coming to ask us how we feel, because the society have neglected us. And I think for people thinking about doing research in this area, we are willing, as speaking as an OPD, representative of an OPD now, we want people to hear our own stories, our own side of the story, before they design any intervention for us. Thank you so much.
Thank you, Israel. So we are coming to a close in this Q&A, but I wanted just to ask if there's anything you also just wanted to add, colleagues online, if to the speakers, to Maria, to Brigitte, and to Israel. Is there anything you wanted to bring in that you're important to say before we just move into a close?
No, I think we've covered most of the key aspects about the really thing. The one point I wanted to say, and Brigitte was talking about it, I think there's some really interesting opportunities around climate, and there's a huge amount of work now with children and adolescents around climate and climate change and the impacts of climate change, and we need to be really sure that children and adolescents with disabilities are included in that research agenda. We've fought hard to be involved in the climate discussions anyway. So I think it's really important. We know that the impact is likely to be worse on people with disabilities. Again, the evidence is still required to fully prove that. But I think it's really important to say there's some interesting work going on with children around climate change. I think we should really ensure that, you know, children with disabilities' voices are heard in that as well.
And I think I'd like to build on something that Maria had mentioned earlier in relation to the twin track approach and how it's really needed in research too. So we do need research specifically with children with disabilities themselves, but they should also be included into any research about children in emergencies, because they make up a part of that population. So if you're doing any research with children with disability or with children in emergencies, you should be thinking about how to include children with disabilities in that, making sure that you disaggregate for it and that you adapt your research methods so that they are accessible for children with disabilities.
No, that's an important point. And UNICEF, actually, we just at the Global Disability Summit, we made a commitment exactly to that point, that, you know, that anyone working in research on the topic of children, given that the likelihood is that 10% of the population will have some kind of disability, 240 million. I mentioned this at the beginning, 240 million worldwide estimated as having a disability. And so, yeah, if you're doing anything on children, you really, really have to bring in this dimension. Same what goes with girls, and from that gender lens, really important dimensions. So thanks, Brigitte, for bringing it in. Israel, anything you would like to add?
Yes, please. Thanks, Gavin. Just to build on what Professor Maria and Brigitte has said, I also want researchers to focus on other forms of disability, because communication early development, communication disabilities are some of the areas that we have neglected. Like in my research work, I couldn't reach out to them, despite the fact that I had people that have communication disability. I couldn't get sign language interpreters. It was quite a challenge for me. And we have a lot of children with disability that are non-verbal. How do we interact with them? People with intellectual disability, how do we reach out to them? These are some areas, especially in the humanitarian setting, that I want us to explore. And lastly, the funding. We need to prioritize funding for research in the humanitarian setting. Irrespective of the intervention, how can we build on evidences to improve what we have been doing, so that we don't keep on repeating what has been done that has not really worked in most humanitarian settings once again. So we need evidence, concrete evidence, research that will influence policy and help us to improve for them. Thank you so much, sir.
No, thanks, Israel. Thanks for those points. I think, and also in this very difficult funding climate that we find ourselves in, of course, any funding has to go to the ground, has to go to children on the ground and families, and has to make a difference. And we need to find ways in which we can embed research into that work. And this is why the intersectionality is important. I don't think we're going to see in the next few years the luxury of having any financing that can specifically focus on disability, unfortunately. So, but we live in a complicated world which is integrated, so our research should also take that approach. This has been a fascinating discussion. We have one more poll before we go, and then I'm going to close out. So on the screen, you should be prompted with the final poll to you, the audience, is to ask what type of research is most needed to assess the long-term impacts of inclusive humanitarian interventions. And we've just been talking about this, so it's just an interesting way of closing out. You have a single choice. The first one is longitudinal studies. Second, innovative mixed methods research. Participatory evaluations is the third. And for that, read participatory research. And then the fourth one, comparative cross-country studies. I'll just give you a moment to reflect on that. I think we'll close that. And my dream is that all the participants today are all donors with big pots of money, and you're listening and can see. So it's across the board. I think all these all these areas are seen as important. I mean, as a researcher, I would not put any weight on the one that's slightly more than the other, but innovative mixed methods comes out slightly ahead. But I would argue any statisticians in the room would say that's probably not significantly different, just to end on a light research note. We have run out of time to do any more questions. I think we've had a very rich discussion, and one that's brought some great perspectives and space that clearly requires, much more investment. And in the chat, you will have seen some links. Please look at, press on them so they open so you can save them. And one of them was linking to the evidence gap map, which basically reinforces this point that we really do have very little research in this space. And we need to find innovative ways to do more. We've touched on how to do it better, possibilities, even in the most difficult settings. We've explored how the power of participatory and co-produced approaches, the role of technology and partnerships. I would have loved to get into a bit more detail about some of these remote sensing techniques and other techniques that can be used in some of these challenging access areas. And the need to perhaps challenge some traditional methods by building research with and not just about children with disabilities. We've heard how even in the face of security risks, ethical constraints, and funding pressures, that there are practical ways. There are some examples where things can be done. So we mustn't fall back and think it's challenging, therefore we must not do this. We must really identify, and as I was wrapping up a little bit before what everyone was saying, I think it's important that we see how we can embed research, participatory research, action research, implementation research. These are all types of things that could be slotted into programs to use research to show what does work. And if we show what works, I think we can demonstrate to donors what their money is leading to, how it's making an impact, how it's making a difference. Anyway, there's many areas we can talk about here to shape policy and practice. And with that, I think we do have to close. I'm just looking at the time. I want to extend my thanks again to our speakers. So to Maria Kett, thank you, Israel Balogan and Birgitta Roveda. Thank you so much for your insights. Please look them up. If you go back to the link where you can register, you will see their profiles. Please check out their work. Please support their work. If you are joining and you've not thought what you're going to do for your master's degree, if you're in that part of your life, Maria has an MSc program which you should really also take a look at and just inquire about. Thanks to all of you for your questions. You're a little bit shy on the questions, but quality, not quantity. Some really great questions here that focused our discussion. Thank you so much. If you did feel there was something you wanted to share, but that you felt you didn't have, you didn't want to share it in the chat, but you do want to share with us, please let us know. If you've been working in this space, if you've been doing research and have some examples, if you'd like us to amplify that research in some way by sharing it, or you're interested in maybe being a theme for a future topic for this Beyond Barriers webinar series, please get in touch. We'd love to hear from you. And before we finish, just a quick reminder that we have one more webinar planned coming up on Tuesday next week. This is where we dive into the topic specifically on ethical involvement of children with disabilities in research. That session will take place on Tuesday. That's Tuesday the 6th of May, same time, so that's 2 p.m. Central European time. If you've not yet registered, then please do so. That again is in the chat. You can click on there, register for that link. And just to say, the webinar that we planned on inclusive education has for now been indefinitely postponed. We'll find a date for that, so please keep an eye out on social media channels for any future announcements of that and when it will take place. And finally, a heartfelt thank you to the Altamont Group. They're behind the scenes, but busily working away and making this happen. Their excellent support in curating and facilitating, and for their partnering with us in the development of this series. A big thank you. And also a big thank you to our colleagues, Zhao and to Oliver from Overseas Interpreting for your excellent signing. Thank you very much. Really appreciate it. and looking forward to hearing and seeing you, welcoming you back on Tuesday next week. So until then, thank you very much, and it's a goodbye from all of us, and particularly from Innocenti. Thank you.